And now I'm going to do the medical wound dressing. First is to prepare needed equipment. Then, wash your hands to prevent any infection and maintain sterility. Next is to introduce yourself to the patients and explain the procedure. Good morning, ma'am. I am your nurse duty for today and I am going to clean your wound as per doctor's order. Identifies client for wound dressing. Then provide privacy. Next is to assess and observe the old dressing for presence of blood and discharges. Then assess patient's condition prior to procedure. Then assist patient in comfortable position. In which the wound can readily be exposed. Then place the rubber sheet below the affected area. Then moisten plaster using CB with alcohol. Next is to remove plaster by holding down the skin and pulling the tape gently but firmly towards the wound. Then remove dressing. Disposal gloves may be used. Next is to place soiled dressing in a waterproof bag. Receptacle without touching the inside portion of the bag. Note the type of discharge present and the appearance of the wound and make sure you document it. Next is to get cotton balls with antiseptic solution using pick-up forceps properly on your dressing trolley. Next is to clean the wounds using cotton balls with antiseptic solution with dressing forceps. Clean the wound going outward motion. For aseptic wounds, using aseptic wound dressing forceps. Ensure proper technique to avoid contamination of the wound or any infection. And clean the area around the wound towards the center of the wound in a circular motion using aseptic wound dressing forceps. Then apply slight pressure around the wound while dressing to observe drainage of exudates unless contraindicated. Next is to dry the area around the wounds with operating sponge OS pad. Then apply ointment with applicator if needed. Next is to apply sterile OS pad one at a time over the wound. Then secure the dressing with plaster correctly. Then remove the equipment and the bag containing the soiled dressing and dispose it properly. After the procedure, don't forget to wash again your hands. Then observe the proper body mechanics. Report any unusual problems in the in-charge nurse or physician. Then records pertinent data correctly on the patient's chart. And that's the end of the procedure.